Just want to say what an unbelievable panel we have here today. I really want to thank you for your respective leadership and for your unbelievably hard work. And I really appreciate you being here today. I'd like to get to 3 different questioners, and I don't have a lot of time. I'm going to start with Ms. Scott at the Canadian Centre for Policy Alternatives and move into a question around childcare. You've talked, and I think all of you have talked a lot about the impact of COVID on women. I think you've talked that the vast majority of those on our front lines and essential workers are women. And I think you know this, Ms. Scott, that, in 2006, 2005, 2006, the Liberal government of the day had signed a number of bilateral agreements with provinces. We tried to bring in a national childcare program at the time. The NDP unfortunately didn't support our minority government at that time, and so we fell and we ended up with a Conservative government that did not follow through on that national childcare program. We are where we are here today, and I can assure you there's not one female MP in office right now that doesn't want to move immediately to national childcare plan. What is the model that you're proposing? Part of the big issue is, or one of the big issues is just the delivery mechanism. Is that it has to be delivered through the provinces because healthcare is in their well, not healthcare, but the education and the daycare buckets is in their bucket. So, what would be the model that you'd be proposing moving forward?
Thank you very much for your question. Childcare, as I said, it's critical to recovery. Any recovery, it's necessary. Simply, women will not be able to go back to the labor force. The childcare sector has been mobilizing in different provinces, putting together plans, not only provincially, but federally. Certainly, the current ask of the federal government, as I understand it, is that they're calling on the federal government to contribute up to 75% of the full operating costs of licensed childcare, conditional on provinces covering the remaining 25%. The concern now is that monies are needed immediately to stabilize the supply of childcare, that many of these municipal, nonprofit, private sector centers are, obviously have lost parent fees over the last number of months, that they are in financially precarious situations. Many will not be able to reopen, as the statistic I alluded to. So they need an immediate infusion of cash to sustain and their sustain their businesses and attachment, and also to prepare for what will be coming, which is, of course, modifying their models of practice to accommodate what it will, I think realistically, we're looking at a year, 2 years of, new methods of delivering social supports, community supports, which require physical distancing, and how are childcare centers, many not who don't have access to those types of resources, going to do that. So certainly the childcare community is looking for the federal government to step up to in a leadership role. Historically have delivered money for childcare through, ECE monies back in the early 2000s. You referred to that, and under the Chrétien government, there were transfers designated to that. Concern, obviously, about how you target that and supply in particular. We're not looking for more money for parent subsidies. The question really critically is supply, and to stabilize supply, those centers need those resources to expand. I think it's really important to attach requirements around what it will mean by staffing ratios, quality of care. This is the opportunity to lay the foundation for a pan-Canadian responsive childcare for all model that we're going to require.
Thank you so much. So I hear the 75-25 model and then sort of national standards. Okay, thank you. My next question is to Ms. Saunders. Hi, Vicki. Really nice to see you, and thanks so much for being here. I'm just going to head right to the question around rents, just because that's disturbing. And I think the model that we've taken on is we've tried to implement as quickly as we could our programs and then make adjustments as we go along. Is it that landlords are just they're not interested in providing support, or is it that it's too difficult for them to actually apply? And do you have sort of a remedy that you may want to suggest? And then I have one more question before I get to my last question.
Yeah, so I think that there's a mix. Again, like everything else, there isn't like one thing that's happening, like X, all landlords are doing X or all landlords are doing Y. I think there's, in general, a lot of landlords are just not applying for it. And using it for various different reasons. They already are getting a benefit. I mean, we have the same issue with our own landlord. They're not giving us any abatement whatsoever, despite the fact that they don't have to pay their taxes right now, and they're getting a 25% cut.
What's the solution?
So I mean, again, I think if this could have gone directly to individuals, I think it would have been easier. So if instead of having to go through the landlord piece.
And then just if you have, as we're moving into the rebuilding phase, you had mentioned 51% of the population get 4% of the VC funding. What can our federal government do moving forward? You know that we've already put in $2 billion for the women entrepreneurship strategy. What more do you think we need to do to be able to continue to help women entrepreneurs get far more than the 4% that they get right now?
Yeah, I think the big challenge with this is that we have a very narrow definition of what is innovation. And it focuses very much on tech and go big. And there are tons of other kinds of innovation out there. There's all kinds of social innovation that isn't captured within this element. And BDC has crazy rules, this personalized collateral, high interest rates, and most of the money has gone through. I understand it's hard. You have to put your money through institutions who can push it out. And you need someone to do that. But the rules of engagement are not good enough for women entrepreneurs in general. And it's partly because of our definitions around innovation and what we're supporting and what we call innovation in Canada.
So that's helpful.
I'll give you one quick question.
Thank
Julie.
you. And it's to Ms. Labin. Thank you for your very passionate presentation. My question to you is, there was a negotiated top-up between the federal government and the provinces. Was that helpful in any way to the workers within your home?
Yes, thank you for asking about that. The province of Manitoba actually just announced today the rollout of that financial top-up. So I do think that will be very helpful for the direct care staff. Some of the parameters are obviously exclusionary. It's income tested, but hopefully that is something that my staff certainly are waiting for and looking for.